All right, if we take our seats and come to order. I just want to welcome all the House members over to the good Senate. Thank you for hosting us today. And because we're on your territory, I'll let you run the meeting, Chairman Baldwin.
Well, that's so kind of you. We're missing a few senators. I'm assuming they'll straggle in here in a few minutes. Pretty informal meeting, folks. We're going to wander through this list. You all don't have a list. We'll tell you where we are on the list of topics. I tell you, we have 24 pages, so it's a pretty significant list. We're going to go through item by item. We're going to forego some of our normal procedures. We're not going to take roll. We know who's here. We know who's not here, and they're on my list. I have a rule in my committee, and I'll just reiterate it here. If you have a cell phone, I don't care. Yeah. No, go ahead and turn it off so it doesn't interrupt the committee meeting. So let's go ahead and let's go through these items. We'll go through one by one. Anybody in the room has a comment, or any of the committee members has a comment on one of these, we'll just go through and then we'll give you instructions when we get to the end of all of them. But we're going to go through item by item, and please tell us your desires or your thoughts on each one. Number one comes from Representative Wiley from the House of Representatives. I'll let you read that one.
Sure, it's competitive premium workers' compensation rates. Anyone here want to talk about workers' comp? Now would be the right time. I don't see Representative Wiley here yet this morning. So maybe we'll skip that one and come back if he shows up.
Okay, the next topic, if you're keeping score, is Denturist Practice Act, brought to us by John Winter and Gary Volan, LD. Anybody here want to talk about a Denturist Practice Act? Wow, the list could go really fast today. Okay. Let's go to item number 3. Requesting a study on unemployment requirements be evaluated and indexed from Tamara Trujillo.
Representative Trujillo is here. So
Go ahead.
Generally committee about, I don't know, a minute or two of kind of what you want to explore, why it's important, why it would need to take a couple of hours of interim committee time. And then we can kind of have, if there's any public comment. So just kind of overall. Yep.
Just to give an overall, okay, thank you. So my idea on requesting a study for unemployment requirements and to be evaluated is to see when we had this last episode of COVID and a lot of requirements were dropped from many different things. And in this aspect, the requirements as far as finding employment, reporting employment, showing up to interviews, we need a study to show how many of these guys and girls showed up to or got an interview for a job, then didn't show up for the interview. So then this employer has already wasted a day's looking into finding employment. And then this person that didn't show up maybe didn't show up and is still collecting unemployment. And right there, you know, they're not living up to the requirements for unemployment. As well as, you know, if somebody's 2 or 3 weeks into unemployment, we give them 30 days of unemployment. So just to evaluate and study that and find where we can tighten our belts a little bit in that area.
Do you want to check with the department? I don't know, workforce services. Do you have any strong desires or there's things we can do and explore?
Okay. Next item is brought to us by Representative Clausen, talking about white bagging, and suggests the Wyoming Hospital Association. We'll have some ideas and some thoughts, and tell us what white bagging is. Hospital Association, want to come up? It's Klaus, I'm sorry. I forget who's on the committee. You guys are all still new guys to me.
I can talk.
Representative Clausen, go ahead and ignore those guys sitting out there.
Okay, sounds good. So white bagging is a process of the pharmacy, the insurance company mandates that the hospital uses those medications for that day at the hospital. Medicines sent to the hospital and the hospital has to use it. Now, what it doesn't take into consideration is some of these medicines are temperature sensitive, so we don't know how well they're handled. Your labs may change that day and you need a different mixture and you can't. Or in the case of my wife a few weeks ago, she drives to Denver for her treatments and the medicine's not there. So it'd take 2 days off work and changes your treatment plan. So you know, this is a patient safety concern. I understand the pharmacies and the insurance companies are trying to save some money, but this might be an area where cutting costs is causing definite patient safety concerns. So, gentlemen?
Go ahead, tell us who you are first, and then tell us all you know about white bagging.
Mr. Chairman, committee members, Eric Bully, President of the Wyoming Hospital Association.
Mr. Chairman, Josh Hannes with the Wyoming Hospital Association.
And this topic came to us from some of our members, Mr. Chairman, and it's kind of ironic that Representative Clauston got caught up in this after we started talking about it. But as he reiterated, it's just a real concern for us when it comes to these specialty drugs for patient safety. And it's a concern from the provider perspective. So we have no control over when these drugs are shipped, where they're shipped, how they're handled. In Wyoming, there are some major concerns about getting those to the right place at the right time. And so we would like to work with the other stakeholders, obviously, as we go through this in the interim, but we just think that this is an important topic, and we're seeing this talked about more and more across the country as we're seeing more and more of these issues where patients are harmed.
Anyone else out there in the audience wish to address this? Nope. Anyone on the committee besides Representative Klaus? Okay, thank you very much.
Thanks, Chairman.
Okay, I believe the next one is from Representative Clausen as well. Insurance reform, recoupment time limits. Go ahead, Representative. I do not see Hollis here. So share all your wisdom.
Well, my wisdom mostly comes from Dr. Hollis, so just, I guess just mostly, I had just read through what he had just put into here. So the problem being, and we see it too, is right now in Wyoming, if the insurance company doesn't like your claim, they can go back 10 years and make you reimburse for treatment. Now, I can tell you as a provider, you know, we have 1 year to get our stuff in, and after a year, we can't get paid. So 10 years is excessive, right? So what we're looking at is just more of a reasonable time frame for medical practitioners. 2 years, I think, would 2 or 3 years, whatever this committee wants to work on. But for an insurance company to go back 10 years and then ask for reimbursement seems to be a little bit excessive.
I see at the bottom here, Representative Clausen, you may or may not know this, that the Utah code, do you happen to know what that code is? Or is it what their statute says? It references that at the end of the topic here.
Yeah, I think I'd have to look with Dr. Hollis again, but I think theirs was 2 or 3 years, but I felt like it was 2 years, but.
Okay, very good. Okay.
Mr. Chairman,
Go ahead.
I apologize. Having not been,
Representative Hornock, I remember your name. Okay,
Hey,
go ahead.
Thank you very much. Having not been through this process before, we've got an entire list of interim topics. Do we need to move any of these? How will they move forward in this process after we go through this?
That's a very good question. Thank you, Representative. What we're going to do is we're going to go through each one, take notes, write down anything you want. We'll have the assignment. When we're all done with all this morning, then we're going to ask each one of you on the committee to go and make us a list of the top, probably 5, your top 5, and then we'll bring that to us and we'll go back through those and we'll decide on which ones we're going to present to management council. So kind of keep track of what you think are the top items, what you want, and that's what we'll be asking is at the end of all this that you will present your top 5 or present us a list. Does that make sense? Okay, very good. That brings up Representative O'Hearn. He's going to tell us about Oregon recipient insurance protection. Go ahead, sir.
Thank you, Mr. Chairman. When I was in presenting House Bill 165, Senator Barlow suggested, what about the recipient? Not just the donor having the insurance coverage, but also the recipient of a living or anatomical organ. So I'll get with the LSO and I'll get with the insurance folks, and I'll probably sit out here and we'll talk about that for about 15 minutes, and I'll present that new recipient bill to everyone.
Pretty straightforward. Very good. Anybody in the audience wish to address that? Seeing none. Pretty active audience this morning. I wish you guys would quiet down. Turn your cell phones back on, please. That brings us to Representative Penn. Topic is daycare. Representative Penn, it's yours.
Yeah, so we've had several daycare bills that went through this session, and I think maybe one finally made it through, but that's definitely a topic that on our chamber side, we've had in our committee, had significant concerns about. There's a real need for more daycare options in our towns. A lot of daycares have been going out for various reasons, and a lot of what I've identified and being approached with and talking to daycare providers, myself being a mother whose kids are still in daycare, knowing the realities of the difficulty of finding adequate daycare. But a lot of the issues are just so much regulation. So, excuse me. For example, I can't recall right off the top of my head the numbers, but the staffing numbers for daycares are very tight. If it goes by ages. If you have infants, you have to have this ratio of staffing. If it's 2 to 3, this ratio of staffing, and so on. And so they have to be very careful that way. But my family, we got dropped from a daycare because there was a new requirement coming that for the number of children that they currently had in their home, and this is a lady that's done daycare in her home for about 30 years. At her current number of children, she was going to have to install a commercial dishwasher in her home. And so how did she respond to that? She dropped back the number of kids down to about 8 or 9 so that she didn't have to have a commercial dishwasher and remodel her home in order to continue caring for those kids. And so things like that is what I think would be beneficial to look at. How can we deregulate daycares while still keeping them safe and increase the options so that we don't have these home daycares shutting down?
Very good. Agency wish to comment on it? The head shake is no. Okay, any questions, concerns? Anybody else in the audience want to address that? No? Okay, that takes us to your next topic, Representative Penn, gender transitioning in minors.
Yes, so, let's see, where did my page 5? Oh, bottom of page 5. Okay, I'm going on to page 6. So obviously we had a bill make it through one chamber and is sitting in another chamber this year. I think I was approached by several physicians that said, let's look at what other states have legislation wise and ways that we can continue to work to protect our children. And come up with legislation that, either basing off what went through this session, looking at what other states are doing and what way, what ways can we protect our children and come up with legislation that we can get moved through.
Okay, agencies wish to comment on that? Departments? I think you guys are pathetic today. Okay, I'm a representative, Chairman Zwanzer. You want to take some for a few minutes?
Oh, take the chair, sure. Next topic up is going to be Representative Ward. First topic, preventing CDC and WHO mandates. Representative.
Thank you, Mr. Chairman. So this is reminiscent of HB 143, and I'm still interested in this topic. I'd like to discuss it as a committee. The CDC and WHO should have no jurisdiction here in Wyoming. And so I'd like to talk about how we could implement that.
Okay, any agency, anyone else on that one? Okay, wrote that one down. And then prosecuting entities who require mask and vaccine mandates which harm citizens. Representative Ward.
Yes, we heard a lot of testimony in our committee on the House side about vaccines and masks harming individuals, and I'd like to discuss how we can get them some compensation.
I see those fun commercials all the time. Get compensation if you've been harmed. Any agency person wish to testify on that? Seeing none. They're just here to watch us today, apparently. Compensation. Next up, Representative Ward, prohibiting mask, vaccine, and testing requirements.
This is reminiscent of HB 66, which passed out of our committee narrowly and failed on the House floor narrowly. I'd like to discuss it in committee, how we can protect the medical freedom of individuals.
And so perhaps a slightly larger topic on medical freedom in general is maybe where the committee should be moving towards. Discussion on that, audience? Director, no? Okay. Next up are my topics. First up, reevaluate discharge requirements for level 2 with assisted living facilities. I do have some people here who wish to testify. If you'd come on forward. Yeah, I think so. Oh. Thanks. We could, oh. You can, yeah. And so committee, this is an issue certainly in my county, and I think 2 others have these type of intermediate care facilities for people who are experiencing memory loss. And I'm not sure if this is actually statutory or rules and regs. We can certainly talk to the director about that, but Sunday, if you want to give us 2 minutes on the topic.
With Cottonwood Creek Memory Care Facility, and we're here to talk about some requirements by law that have been written decades ago that state once a resident becomes unable to transfer, or if a resident is a 2 max person assist or a total assist transfer. If you guys are familiar with dementia, a lot of our by nature dementia residents are going to forget how to walk, how to talk, how to eat. This is just the nature of the disease. You see residents that go in waves. One day they seem to be perfectly fine, the next day they're not. They forget how to walk. And we come into a problem with them having to leave our facility and into a nursing home. And that's based off a requirement that states that they have to evacuate our building within 5 minutes with 1 assist person. That's not logical. We are a facility that is specifically trained in dementia care. We see our residents through mild stages of dementia to severe stages of dementia. Our staff are specifically trained to care for these individuals. When we move them out of our facility into a nursing home, they go into a nursing home with 30 other residents with staffing ratios of 1 nurse, 1 aide with 30 residents. To me, that doesn't make sense. We're a small unit. We have 16 residents there. Our staffing ratio is 4 to 1, which means that if I'm going to safely get my resident out of that building in case of an emergency, I would have much more success in doing so. 1, because I know that resident, I know their behaviors, and as a nurse and a CNA staff, we are able to operate equipment such as a Hoyer lift, a sit to stand, to get those residents safely out of our building. So that requirement doesn't make sense to us. We love our residents. We are their family. If you guys have family members with dementia, it is the worst disease that you'll ever come across. It's a disease without a cure. The anguish that our families go through and our residents go through are significant. And we love them. We want them to be able to stay with us until they take their last breath. That's what we're designed to do. And I'm asking you guys to change that law that states that they have to move from our facility into a larger facility where they don't get that attention, where they're going to be stuck in a room. And I don't want to say anything bad about any facility out there, but they're loved with us, and we want to be able to keep that care with them until they move to the next life. And also, I guess while I'm talking about this too, there's other regulations which states that a resident has to move if they have catheter care and our staff, for some reason, is unable to handle that care. We're nurses, we're CNAs. Why can we not empty a catheter bag or an ostomy bag? Those regulations don't make sense. But what does make sense is these people staying with us until they pass from this life to the next.
Okay. So it might be a little broader committee on just licensing regulations in general with long-term care, nursing homes, et cetera. I have another topic here as well. So any questions? Just All right.
Mr.
Thank you.
Co-Chair,
Yes, Senator.
so across the state, we're losing patients out to larger facilities just through requirement? I'm not familiar with all this.
Yes, when a resident becomes unable to bear their own weight and they need more than one person minimal assist, then by state regulation, they have to leave our facility and go into a nursing home. And that is across the state of Wyoming. Wyoming is expected to have a huge rise in the aging population. Dementia is also on the rise, which means that many of you will probably get dementia. Many of your family members will probably have dementia. And we have to think as a society and as a state, what is the best place for these people to be at? Is it going to be in a skilled nursing facility where they don't get that training to deal with these people? Or is it going to be in a facility like our own that has that training to be able to care for these people?
Just a quick question for you. You mentioned it's a state regulation.
Yes.
Do any of the states around us have different regulations that you're aware of?
Yes, Colorado does. So Colorado has their regulations is they can keep their residents until they pass away, but they're still able to provide them more of a nursing skilled facility. They're still be able to do catheters, ostomy cares, use the total lift, a sit to stand, all of those things.
Thank you, Mr. Chairman. So just to clarify, we're talking about the difference between assisted living and skilled nursing, correct?
That's correct.
And so are you saying that you're wanting to look at increasing the capabilities of assisted living?
Right now, we're a level 2, and with dementia care, I think that it should be a category all in its own. I mean, you can amend what you have on the books and change those discharge requirements of what you already have, or maybe you can just make a new category just for dementia care, the level 3, and that's what's on that handout there. That first column, level 2, kind of tells you what is on the books right now, and the part in red is I'm asking you to kind of consider what we can and cannot do in a dementia care facility.
Okay.
So yes, it would be either in a change on what the requirements are now, or maybe just make something completely different. I don't know.
Okay, thank you.
The fastest one.
Representative Clausen?
Thank you, Mr. Chair. Are you able to speak at all to like reimbursements, costs between being in assisted living and skilled nursing facilities?
You know, I don't have any cost with me, but I do know that when you're moving people from one institution to the next, that becomes a higher cost for the state. We are a private facility, so our residents do pay privately. They don't pay with Medicare. So you're actually, if you move those residents out of our care into the state, then they become a state-funded resident more than likely.
Hutchins, Senator Hutchins?
Thank you, Mr. Chairman. A quick question on the wording. You're saying regulation, and I'm wondering, do you mean statute? Because if there is a statute in the Green Books, the law, can you identify where that is? And if you can't, maybe the chairman, Zwanitzer, can provide the members of the committee with the statutes on what you're talking about.
I believe, I don't have the numbers in front of me, but I believe it's section 8 out of the 18. I don't know.
The
I'm
director
sorry, I
behind you
don't have
saying
that in
there's some
front of me.
statutory issues,
Yes.
so.
So you'll get those for us?
Yeah, I certainly
Thank you.
can. See, I bring all the fun topics all the time. We get a lot of public comment. Anyone else on this topic this time? You're a good director? Okay. Thank you, Gal, very much.
Thank you.
And then on the sheet, I think there was just a copied twice. So moving over to residential rental housing regulation and licensing. I know this committee likes regulation and licensing, apparently. So committee, this is a topic. It happened in the city of Laramie. We haven't had any significant, I would say, landlord-tenant laws in over 20 years. We've had a couple of bills that haven't made it through. We had a community in a completely unbiased way at the municipal level put on some further restrictions and requirements of landlords. And then they had a court case and it's a little complicated, but in the court case, it did say that, maybe the legislature needs to further clarify, is landlord tenant a statewide, or are cities allowed more power to further regulate, landlord tenant law in their municipalities. And so I think because I'm on this committee, it got sent with my name to Labor Health. Housing has been a big issue. We had it in the House Minerals Committee, went down by one vote on workforce and affordable housing. And so I do think housing is coming to some committee, whether or not that's labor, health, or corporations, or minerals. But we do need to, some committee needs to look into kind of just it's been 25 years, and it's time with all the issues going on in housing. So I don't know if Mr. Glass is here. Anyone else wish to talk about housing? Director, you want to talk about housing? Oh, just checking. You got up? Okay, so just no committee, that's a topic that is out there, and I think internally is being discussed to go to some committee, whether or not this one. Next topic is also mine, State Refugee Office. And so this one's a little more controversial, obviously. Wyoming is the only state now that does not have a refugee resettlement program. And we did make an attempt, I think 6 or 7 years ago. It did not go very far. Certainly a lot of different thoughts out there in the state on whether or not we want refugees, immigrants, asylees in this state. I think what we saw, though, in the last year and a half, and I think many of you know I have this issue in my family, we do have asylees and refugees coming to Wyoming, staying with family members, primarily from the Ukrainian-Russian conflict, which is ongoing. The issue we're finding is there's we don't have any state level or federal level program in Wyoming to provide any of the services that they would get in any other state. When it comes to job training, educational training, we've had to kind of do intermediate steps individually with our community colleges, with our departments for some of these services. And so this was brought by one of our constituents in Laramie County, who also, his spouse and family, they have a family member who has fled the war and is staying with them. And I think we all know there are probably at least 20 refugees right now in Wyoming from that conflict. And so the question is, does Wyoming want to look at establishing a refugee resettlement program? Primarily, these programs fall under the Department of Labor and Health at the federal level. That's where a lot of this funding comes from for care, for housing, while they're awaiting their court hearings to become citizens or become official asylees. So it was brought by a constituent. I don't know if Mr. Wiggum's here. I don't see him. But whether or not we're ready as a state to be the 50th state to take on a refugee resettlement program, it would take some time in the interim to discuss and look at the pros and cons. So that is that topic. Happy to answer any questions.
Chairman?
Yeah.
What's a state refugee office cost? And you mentioned how long that waiting for citizenship and stuff like that. Do you know what other states our size are paying?
I know it's certainly a couple of $1 million. I don't know exactly how much state level or federal level dollars those are. When we looked at it last, I think it was $4 or $5 million. And it's a partnership with the federal government and at a state like Wyoming, where we could use some population and especially working age population to come here and resettle. And we could, I think, put parameters around that depending. So it was asked from some constituents. Representative Yoon.
Mr. Chairman, thank you. I've looked at this topic before a little bit. And from my understanding, there's just federal legislation that requires enabling state legislation to take in federal funds that are used for refugee resettlement. So even at the minimum, if we didn't open an office, some states, they really just specify this is a nonprofit group that these funds should be directed towards. And it could be as simple as that, requiring no state funds. So all of that, I think, is within the realm of what's worthwhile at looking at in the interim topic.
Other thoughts? Departments, anyone out there? Okay, seeing none. Next up, they ordered these by legislator. So next, a certificate of need for long-term care facilities. This one's brought to me from the Hospital Association if they want to come on back, Mr. Boley. And so I continue to hear they're all kind of disparate, but they're all associated when it's coming to what we're doing as our state gets older and they need more care than we've traditionally given. And so you'll see there's another topic about nursing homes after long-term care. But if Mr. Bully would present this one for me, I'd be appreciative.
Thank you, Mr. Chairman, committee members, Eric Bully with Wyoming Hospital Association and also Leading Age Wyoming. We are a state that have certificate of need in place for long-term care, and it's kind of prohibitive in what we can do. So we have one particular instance over in Laramie where there is an existing nursing home, but there are a lot of feelings about how that is owned and operated, and there's an attempt over there or a thought of potentially building a nursing home. But under the current certificate of need, we're not able to do that because of occupancy levels and other things. Our certificate of need is also pretty limiting as far as existing nursing homes, increasing the numbers of beds that they have. If they need to expand, they're only allowed to expand the numbers of beds every 2 years. They can only do up to 10% of their existing beds, and it can only be a maximum of 10 beds. For those of you that are familiar with the nursing homes in the state, a lot of them now are greenhouse, and they're designed in pods of 12. And so if they want to increase the numbers of beds they have, they could build 10 of the 12 beds in a greenhouse pod. Also, as we heard from the assisted living folks, we're an aging population, and we need to be prepared for what's to come. There are a lot of issues with staffing right now for long-term care and other healthcare related organizations, but I think a look at the certificate of need, whether we modify what we currently have in statute or whether we repeal it, makes some sense at this time so that we can start planning for the future and take care of the needs of our citizens.
Okay. Anything from the committee? Anything else on this topic from the audience? Okay, thank you, Mr. Bully. Next up, I think two more, but they're all kind of a little bit related. Funding and staffing levels on CMS requirements, primarily in nursing homes. Ms. Passano, if you want to come forward. And so this, is a similar topic to what Mr. Bully just presented and what we're dealing with. Nursing homes are, they're just extremely expensive. Federal and state tax dollars and movements, and we're also having severe difficulties finding enough workers for these facilities. And so Ms. Passano and her association would like us to at least start looking through what possibilities there are for more CNAs and to start developing that workforce. Ms. Passano, if you would add on to that, please.
Good morning, Mr. Chairman and Committee. Carolyn Pasto with the Wyoming Healthcare Association. We do find ourselves in Wyoming in a position with an aging population. ANI has put out several notices about that, what we're going to be dealing with in the near future. And yes, the assisted living speakers did talk about the growing number of dementia. And at the very top, of course, is what we talk about with Alzheimer's. Long-term care has lost a lot of what they were before COVID. They were, in essence, put behind a great deal because of that lost staff and, of course, lost residents. And at this point, it is imperative that we look to the future and what we're dealing with in regard to the growing number of elderly in our state and what we have got resource-wise to meet that need. And we understand from CMS, they're very good about letting us know that they, in the future, are going to mandate a 4-to-1 staffing. That does not mean total staff. That means nursing staff. And we do not have the people in the state to meet that. And as the money has been withdrawn, the federal dollars have been withdrawn, we don't have the resources to pay the very high price that nurses and nurses' aides demand to compete. Our sister state to the north has lost several nursing homes. They have gone out of business in the last 2 years. We find that rural nursing homes less than 100 residents, and yes, in the rural area, and less than 100 residents. That is Wyoming, if you want to look across the state. We have not lost what Montana has. That doesn't mean that we are in the clear. I just had a call last week from one of our rural facilities, and the administrator said they cannot pay as a big a wage for CNAs as McDonald's in their small town is able to pay. The competition is difficult. I believe that it's time, we've heard this subject for several years now. And yes, we all are tired of it and wish we could solve it so it would go away. It is not going to go away. We are the least populated state in the nation, and therefore finding enough staff to take care of the growing number of elderly, and especially as the numbers of dementia grow. And by the way, yes, they are trained. They must be trained, and we actually have units that are memory care units rather than dispersed throughout the population in a nursing home. In what I wrote, I am suggesting that we might want to look beyond where we have been or where we have been thinking. Europe and Japan especially are utilizing robots because they don't have enough personal staff. We might look at that, and we see robots in grocery stores mopping the floors. We see in restaurants, white tablecloth restaurants, some of them have started using cute little robots to bring food to the table. We might think ahead and be thinking about that. And actually, I was thinking it might be worthwhile to get an engineer from Japan who's been in the business for 30 years or so and developed robots and other devices that the body can utilize so that an elderly person can actually get up and down from a chair or in and out of bed. It might be time to be thinking about that and get such an individual on a Zoom call and talk about it. We might not move forward right now, but we would be looking to the future. We cannot sit still. We're going to be hurt, and we'll lose those nursing homes that might be on the wire. It's been a long haul. It's been difficult, lost a lot of workforce, and we have to find an answer. And certainly one of those answers is having an LPN school in our state. Thank you.
Thank you. Questions? Okay. Anyone else? Yeah, Senator Broussard.
Thank you, Mr. Chairman. My question is, are we still requiring vaccinations to the people in these facilities? Because I mean, that seems to be one of the biggest deterrents that happened during COVID is people were leaving. So I want to know what we have done to address that.
Ms. Pastor?
Senator Broussard, yes, the CMS is wanting to have vaccinations, and they're talking about the new variant, and they send out notices often in that regard, and not all staff are vaccinated. They are pushing all staff and all residents be vaccinated. It is still a very pertinent subject.
Yeah, follow up.
Thank you, Mr. Chairman. So is there any talk within the facilities of pushing back at this? I mean, I don't see us getting to a point where we have an influx of people to come into work if we keep telling them, you're going to do as I say. So how are we going to get there?
Asno, go ahead.
Senator Richard, Mr. Chairman, this is a very serious subject that you are bringing up. It's been a subject within the committee, a joint committee. We, as states, are dictated to by the federal government. We haven't found the answer that is going to set us free because dollars are attached to that subject. In nursing homes in Wyoming, in ours, Wyoming Healthcare Association, nearly 70% of the residents are on Medicaid. Money is needed to care for them. And without doing what the federal government is telling us to do, and with the fear that the 4-to-1 ratio for nurses and CNAs is coming, we have to have the money to care for those individuals. Yes, I would hope that you all would find the answer for us.
Okay. Anyone else on this topic? Seeing none. Oh, Representative Ward.
Thank you, Mr. Chairman. Would you agree that it doesn't matter how much money we have coming in from Medicaid, if we're still requiring people to get vaccinated and we can't get workers, all the money in the world isn't going to help us? Do you agree?
We have not, Representative, we have not reached that point today. When that point comes, each of us in this room will have had warning that the day is here. We do have to find a way. The congressional delegation is a part of this. The governor's office is a part of this. And I just saw a resolution by Western governors that now the Western Governors Association is aware and talking about what the needs are.
Okay. Thank you very much, Ms. Passano. And then my last topic is just the general Medicaid reimbursement rate, right? So we're not passing Medicaid expansion in Wyoming anytime soon, it looks like. Those of you who've been here know that we did a pretty substantial 3% cut to our funding. And some of the reason we have such a nice surplus right now is we didn't necessarily replace that cut as of yet. And so I know Appropriations is also looking at this. It was officially brought by Mr. Bully from the Hospital Association. I don't know if the Hospital Association has any more comments, but it would be to look at what happened when we cut our Medicaid reimbursement rates, see where we are compared to other states, decide if it's time to increase those funds, especially for mental health care, which is a significant issue we continue to deal with. So that's why it's on the interim topic list if we would like to pursue that and think about helping out our doctors and hospitals and increasing the Medicaid rate. Any comment on that? Yeah, Senator Representative Hornock.
Yeah, I do have a question on that. How does this relate to the upper payment limit that we allow?
Certainly broader than the, I think we have the upper payment limit in 5 various kind of specific targeted need areas. This would be more across the board. And kind of the big thing is still Title 25, which keeps coming up every year. And I'm not sure if we're ever, I don't know, we ever solve it, but it's kind of been bounced around to various committees, all Title 25 issues, which tend to come down to funding. We've spent a year in judiciary looking at Title 25, and we thought about moving the ball down the field, but then it always kind of came back to who's paying the bill, and it always comes back to reimbursement rates. So that's where we've been. No thoughts out there? Director, do you have any? Certainly appreciate hearing from you on this topic.
Thank you, Mr. Chairman, members of the committee. Stefan Johansson with the Wyoming Department of Health. Just a few comments there. You're absolutely right. About 2 years ago, we implemented pretty significant budget cuts when the state faced pretty precipitous revenue declines. A couple of years before that, in the, I believe it was the 2017, 2018 biennium, we also had a significant round of required budget reductions. As one of your largest general fund budgets, when those cuts are mandated, much of that is felt in the Department of Health. And given that over 90% of our budget goes out to providers and businesses in the forms of reimbursement, that's really where those budget reductions, the impacts are felt the most. In terms of, if I may, Mr. Chairman, to answer Representative Hornock's question, he's right to bring up the upper payment limit. Generally speaking, across the Medicaid enterprise, we are not allowed to pay more than Medicare would reimburse for the same service. That is what's known as the upper payment limit, and we're more than happy to help this committee staff that issue, analyze that issue of where our rates are, where they've been in recent years, and what the policy options might be there. As you mentioned, a lot of our access issues do come down to reimbursement, especially in a large geographic state with a small population scale. Achieving scale is very difficult in a lot of our communities. So we'd be more than happy, Mr. Chairman, on this topic, and I'll take the opportunity now on all of the topics you're considering for the interim. As many of you know that we've worked with for a while, we're absolutely more than happy to help analyze and tease out those issues, provide the committee with education or materials. We have a lean and mighty policy and research analysis staff that I think has done good work over the years with this committee. With that, Mr. Chairman, happy to answer any other questions you all might have.
Any questions on reimbursement rates at this point? Seeing none. I'll turn it back over to you, Senator Baldwin, because the next 5 or 6 topics are yours.
How kind of you. Thank you, Mr. Chairman. The next 2 topics are related to behavioral health and mental health. If we can have Ms. Somerville come up to the table. First one is about a behavioral health technician certification with EMS folks. The idea being that EMS folks would be more available in a crisis need. It's virtually impossible to have master's level people out there for every crisis that comes up. That's something I think needs addressed across the board. So Ms. Somerville, enlighten us, please.
Thank you, Mr. Chairman. Andy Somerville, Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers. And you'll see a couple of these topics, all, in fact, 3 of them on behavioral health interweave. This one is based off of some model legislation from Utah that was passed in 2021, where they actually created a behavioral health tech certification pathway for their EMS personnel, so their EMTs, their paramedics. They are far enough out now that I believe they're finally in a good spot with that program to look at education requirements. The main impetus behind that is having more behavioral health folks out in the rural areas to respond to a crisis. So, Mr. Chairman, we would ask that the committee take a look at this, see if this is a good option in Wyoming to help build out our mobile crisis response across the state.
Any questions for Ms. Somerville? Seeing none, let's go on here on the next topic as well, on the master level mental health clinician, education, recruitment, retention, reimbursement, et cetera. Obviously in Wyoming, we have a shortage of mental health workers, a shortage of people. Telehealth has helped, but we have a problem. So go ahead, Ms. Somerville.
Thank you, Mr. Chairman. On this topic request, our shortage of mental health master's level clinicians is significant. It's serious. It's the worst that we've seen in anybody's memory that we can find. It prevents us from providing care in a timely manner and in the way that we would like to. And I would tell this committee you'd be hard pressed to find a master's level clinician that doesn't have a wait list right now to be seen. And so what we'd like to look at, along with the compact that was passed this session, we'd like to look at our recruitment and training and retention strategies and maybe talk about a few different things. We do not have a student loan repayment program to support mental health technician or mental health clinicians in this state. We do have a HRSA program that operates in some areas of the state, but it doesn't hit some of our highest need counties. We'd like to look at how we are offering education to accelerate folks through a career ladder. If they have an associate's or bachelor's degree and they're working in the field, how can we help them to stay in place and train in place? So, Mr. Chairman, just a few things we'd like to look at there to see if we can continue to make some strides.
Questions on this topic? Seeing none, that brings us to one. Oh, go ahead. Representative Ward.
Thank you, Mr. Chairman. Does this sector require vaccination for its people to participate in the labor force?
Ms. Somerville.
Mr. Chairman, Representative Ward, that is dependent on the individual establishment or agency's policies.
Okay, that brings us to the third topic. If there's anybody else in the audience, we'll just catch them on all three. This one talks about crisis response, specifically with 988 that we just passed. Crisis response is a piece of that. Talking with someone out of the governor's office, the other piece that I've proposed to this is crisis intervention when first responders respond to something tragic, i.e. the EMT that was killed on the highway. We need crisis intervention teams to come in and work with those first responder teams. So I would propose that that be a piece of this as well. Right now, we don't have crisis response teams, so go ahead.
Thank you, Mr. Chairman. This could be as small or as narrow or a large a topic as you'd like it. Mr. Chairman, I would just start to say that for the last several years, there's been a select committee on mental health and substance abuse. It is unclear whether that committee will continue into the future. Primarily, that work has centered around behavioral health reform. Crisis response is absolutely part of that behavioral health reform process. So we'd like to give the opportunity to the committee to talk about 988 and mobile crisis teams and what that response could look like. I believe there's some conversation that may be had around adolescent crisis, and then for sure for the EMS personnel and their support and the crisis teams that roll out that way. It's a big topic. It's the next step in towards improving our care in Wyoming.
And committee, I may suggest at this point, when you form your own list of top 5 things, you may want to lump some of these things together. These all deal with mental health. They all deal with crisis intervention. You may want to just lump some together and call them one item. So Chairman Scott would have lumped several things. He probably the whole list. So, Charlie, yeah, he's not here. So, yeah. Okay, go ahead, Representative Ward.
Thank you, Mr. Chairman. Can you get back to us with how many facilities require vaccination? It's also connected to this question.
Mr. Chairman, Representative Ward, I'd be happy to.
Okay. Anybody in the audience wish to address the mental health issues we've been talking about? Anybody in the audience wish to address their own mental health? Everybody smiles, so that's a yes. Okay, that brings us to the next topic under my name, and this is one we talked about. Not very many people were on the committee last year, but those who were would remember this, the statewide regional forensic pathologist. We had a discussion. There's only one forensic pathologist in the state, and he's very, very old right now. Matter of fact, I'm surprised he hasn't retired at this point. Most of our counties, most of our sheriff's office, most of our coroners are ending up going out of state for the pathology needs. It's becoming an issue. It's becoming very expensive. There's been some discussion about establishing a statewide regional forensic pathologist office. Now, I would tell you up front, the part of this is there's not very many forensic pathologists graduating from medical school. It's not a popular field. It's hard to get people. So it may be something we may or may not be able to get. But I think we need to have further discussion because we're about at that point now where we're not going to have a pathologist. All the counties are going to end up, and I don't think Commissioner Nyman's here. But this is an issue we addressed from another issue. The county commissioners have not come to us with this, but it's something that they were going to discuss. I don't think it's a long time. It's probably a 3 or 4 hour process, but they with the county or with the Department of Health, we need to work through this and get something because we're about at a crisis point. Anybody, department director, anything to add to that?
Question, Mr. Chairman.
Go ahead.
What does the lockout mean? Previously led to lockouts on number 4. Overutilization of out-of-state pathologists has previously led to lockouts. What does that mean?
I honestly can't tell you. Maybe the director can tell us.
Mr. Chairman, thank you again, Stefan Johansson with the Department of Health. We helped the committee at the request last interim study this issue and come up with some concept for what a statewide regional forensic pathologist office would look like in terms of the volume that we typically see, where those pathologists are needed, and where potential locations would be. Again, to remind the committee, this would be a state-run operation to deal with the volume and the limited supply of pathologists that we have. Certainly not a perfect solution, but one that I think warrants additional discussion. Representative O'Hearn, to your question, if memory serves, and take it with a grain of salt because it is based on memory, some utilization from counties using out-of-state pathologists, essentially transporting bodies for that pathology work across state lines, have resulted in in caps on being able to access that service. So we're not, if I'm in Utah or Colorado saying we're not taking any more business from you. I believe that was the issue, but happy to follow up if I'm mistaken.
Other questions? Representative Warnock.
Yeah, thank you, Mr. Chairman. How would this pathologist, how would they connect with CDC guidelines and WHO guidelines and that kind of thing? Is there an overlap, I guess?
Mr. Chairman, Representative Hornock, this is mostly a state issue. So right now we have certain requirements for counties and coroners regarding this type of work. It's not really a federal issue. Certainly there's best practices and things out there from various associations, but this is more of a state regulatory requirement and a lot of local control for how counties deal with the need for either coroner cases or otherwise when folks pass away to get those forensic pathology services. Representative Hornock, to briefly summarize the work last year, which again was a conceptual analysis and study from our department to this committee, would really look at where a forensic pathologist or pathologists, operated or paid for by the state could be located in the state, so that when counties or various jurisdictions have bodies that need forensic pathology services or coroners need those services, they could access that from a state provided resource as opposed to looking out of state if our one pathologist in the state is not available.
Very good. Representative Ward.
Thank you, Mr. Chairman. Do you know if this sector requires people to be vaccinated? If you don't know, can you get us the numbers?
Mr. Chairman, Representative Ward, my understanding is no. Again, the vaccine requirements from CMS are specific to certain types of healthcare facilities, hospitals, nursing homes, intermediate care facilities, a few others. Happy to get you that list of where the regs stand currently. And I might mention, Representative Ward, since that's come up a few times this morning, we are certainly, and I am certainly looking forward to what any changes to regulations might come from the federal government, especially with the expiration of the federal public health emergency. I can say, and I won't speak for all of the other healthcare facilities, but certainly for mine, our safety net facilities, we've been in quite a few discussions with CMS over the past year, but especially even the past two or 3 years of what those relaxations could look like. Given not only the staffing challenges we have, but what some of those requirements present on the logistical side.
Okay. Representative Penn.
Thank you, Mr. Chairman. So it's talking about establishing a state office, but we currently have a forensic pathologist in the state. So is he just working out of his home or a private situation, or why do we need an office if we currently have someone that just needs to be replaced? And then I have another question or a comment after that.
Go ahead, Rick.
Mr. Chairman, Representative Penn, it's really a county function. So counties, when the coroner, for example, needs certain service like a forensic pathologist, there's one county that has one, and he offers, as I understand it, offers those services on contract to those counties. So it's never really been a state office that we've had. The question came up last interim, again, conceptually, should there be one to solve this problem of the limited supply of pathologists?
And then I just wanted, thank you. I just wanted to make a comment really. We give $10 million to WWAMI every year to create physicians in Wyoming. Could we get them to incentivize turning out a forensic pathologist, extra scholarship or something like that with the money that's already been appropriated to them to help us with this issue? Just a thought.
Interesting thought. And on that thought, there are some discussions coming up concerning WWAMI, WICHE, all those programs coming here shortly, because there are some issues we need to address as far as primary care and other things. Part of that issue is that unless we make a mandate, they're likely going to go into orthopedic surgery as an example, because that's where the money's at. So anyway, have you decided? Representative.
Thank you, Chairman. Director, just, thinking about the workload in Wyoming, Just the size of our state, a lot of these services, I just wonder if we're not better off contracting out. I mean, these bodies are going to need transported, whether we have one spot in Wyoming that takes care of them or not. So have you guys looked at the contract costs versus opening a separate office?
Go ahead, Director.
Mr. Chairman, Representative, to my knowledge, we didn't look at contracting specifically. That's essentially what happens now, but with county resources. And we're happy to share I believe we presented at the June meeting, Mr. Chairman, if I'm not mistaken, happy to share that analysis and presentation. We really looked at what the cost to the state would be if we were to hire, one or two state positions, locate them regionally and provide that service. I'm not sure if we looked at contracting costs, but I'll follow up with you, Representative, and we can get you the results of that analysis.
And I would suggest that would be actually a part of the topic, is actually bringing the counties in, bringing the folks in that are involved, and get all those costs presented to us. Maybe not do anything with it, but if it's something we need to do something with, we could. But that would be part of the presentation. Okay, thank you very much, Director. Boy, I got my name on a lot of these.
They all go to the chairman.
There's one on the bottom of page 14. There's also a similar one on page 16. So let's bring, these both involve violence against healthcare workers. Let's bring a hospital association and Ms. Decklever up if we could. There were some proposed topics or bills this year that dealt with violence against healthcare workers. I don't believe any of them made it too far, but
Get to the Senate.
no. So either one of you, both of you, don't talk at the same time and don't talk with your mouth full. Go ahead.
Sure. Mr. Chairman, again, Josh Hans with Wyoming Hospital Association. So for a little context for the committee, last interim, this topic came before the Judiciary Committee. We spent some time at two different meetings talking about it, had a bill drafted, and that bill failed by one vote in the last meeting of the interim. We had a bill brought by some of you all up here as an individual bill that made it with unanimous consent through the House Committee, and then on third reading, unfortunately failed. About the same time, Representative Washut brought a separate bill that dealt with disturbing the peace in healthcare facilities. That also passed out of the House Labor Health Committee, but was never considered on Committee of the Whole. So we think there's opportunity for building some consensus around this issue. It continues to be a priority for our members, and we'd like to spend some more time working with you all on this and get some legislation passed.
Ms. Decklever.
Thank you, Mr. Chairman, members of the committee. Tony Decklever with the Wyoming Nurses Association. And this continues to be a topic in our field, especially with the emergency room nurses. And we realize that there is work that needs to be done on both sides, whether it is with the staffing, with the training, with the facilities accountability. But sometimes having a little bit of legislation to push the issue helps. And we do know that Wyoming is the only state that has no legislative statutes or work around specifically healthcare providers, where we don't consider ourselves a special class. We consider ourselves part of a group that has to work with folks that are in very, very tough situations. And when we're talking about staffing, this goes back to staffing and why people do not want to work in our healthcare facilities, because they don't feel safe. And so we think that providing something for our healthcare providers that show them that we care about them and that we're working towards this would be helpful.
Okay. Questions for either of these two? Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. Can you give us an example of how someone would assault and why the police can't expedite this problem?
Mr. Chairman, Senator Bouchard, there are lots of examples of assault, because assault in and of itself is the threat. So just threatening somebody that I am going to hurt you or I'm going to hurt somebody, that's assault. Battery is when they actually touch you. So when people shout out mean things, there is a level that we can tolerate, because we understand that people are in these positions. They're scared, they're hurt, they're sick. There is nothing that states that a healthcare professional can't call the police if they feel threatened or if they're bodily or if battery takes place. Unfortunately, there is this overall theme or culture that says as healthcare providers, especially nurses, that we just have to take that it's just part of the job, that it's okay when people threaten us and it's okay when people beat on us. And so it becomes an internal, oh, I can't call the police, or I can report this to my provider or my employer, but nothing is ever done. So there's no point in reporting it another time. And we just have to, and what I said, that the accountability falls on us also, is that we have to not allow that to happen. If we are assaulted, we have to say it is okay to call the police. There's nothing that stops us from doing that other than an internal culture.
Okay. Very good. Go ahead, Representative Trujillo.
Thank you. Do you think we need to make stricter laws to hold your employers more accountable for the workers' safety?
Mr. Chairman, Representative Trujillo, maybe? Maybe that would help.
Okay. Senator Hutchins.
Thank you, Mr. Chair. Mrs. DeClever, as I listen, we already have laws on the books. Can't assault, battery, someone calling you a name. In this business, they do it all the time. If you don't take the action yourself to deal with the assaults and battery, what kind of law do you think we can pass out of the legislature that can make this better for our nurses?
Mr. Clever.
Senator Hutchins, I've heard over the last couple of weeks statements that say this is already in law, but this legislation would help codify it, or would codify it more, or make it stronger. And so you're correct. There already are laws on the books. Part of what we are trying to put together here is not just that it's against the law to assault someone. That's already on the books. We would like the penalties to be stronger for healthcare professionals like it is for other folks. However, the legislation that we were trying to pass actually had 4 different components to it. It had training, it had developing a program, it had reporting, and it had penalties. And so are the facilities able to do that themselves now? Yes. Do they all? No. So that's what we're trying to state, is that we would like all of you to develop a program that protects your employees. We know it's the right thing to do, but sometimes they need a little push.
Go ahead,
Mr.
Josh.
Chairman, if I may, Mr. Chairman, certainly echo everything Ms. Stecklever just said. And in addition to, if this is taken up in the interim, we're happy to bring you from the hospital perspective the things that we are doing internally to create safer environments for our employees. I think it's also important to recognize that healthcare workers are 5 times more likely to be assaulted on the job than any other profession. They are a more vulnerable group. The law recognizes different penalties for more vulnerable groups already. We think this is a group that should be included in that, and we're happy to spend the interim talking about what we as facilities need to be doing, should be doing, where there's gaps, and take that on as well. But we think that there's some public policy change that would also be helpful.
Very good. Go ahead, Representative Penn.
Thank you, Mr. Chairman. So we're talking about, educating people and making sure that they understand that it's good and right to report these things. What has the Nurses Association or other, hospital association societies and things, what kind of marketing campaigns have you been putting out to nurses to encourage those types of behaviors, or encourage hospitals to make sure that their employees understand? What are you doing right now to address that?
Mr. Chairman, again, happy to go through specifics. It's different by facility, but all of our, I don't want to say all, a majority of our facilities have internal reporting mechanisms when there's an incident of all kinds, not just attacks. There's training for nurses about how to deal with these situations when they come up, whether they're reported to law enforcement or not. And then even what happens beyond that is often dependent on the victim in that case, how far they're willing to pursue it, what the county attorney is willing to do, what the police department's going to do, and that varies by community. But again, happy to dive into specifics if given the opportunity to do so.
Okay. Thank you very much. Oh, go ahead, Senator Bashar.
Thank you, Mr. Chairman. Can the Hospital Association give us some direct examples of these assaults so we know what we're looking at?
Mr. Chairman, Senator Bouchard, absolutely.
Okay. Okay.
Are you looking for that? Do you want them right now?
Go ahead, give us one.
Sure. They are everything. I mean, we've had, so I'll just share examples that were given in testimony in other committees. Things varying from a pregnant physician being kicked in the stomach on purpose, a nurse who had been dealing with a patient for several days, who, with no incident, had her head grabbed and smashed into a door, people using their badge lanyards, patient grabbing those and putting them around their necks, patients' families coming in threatening to kill nurses and that they'd be waiting outside for them. We have a number of stories. And I would say too that it's been on the rise the last 2 years, and some of our small hospitals have seen double and triple the number of incidents that have taken place compared to previous years.
Senator Bouchard, if I could add to that, I am a registered nurse and I've been kicked across the room. I have been held in a neck lock, like a wrestling neck lock. I have a friend who is a nurse that was taking care of a patient, and they didn't like the husband didn't like the way she was being taken care of. So he took a knife out of his boot and sliced her arm. And when she went down to the emergency room to be stitched, she was told that she was not to report that to law enforcement and that she needed to apologize to the family because it was her fault that this happened.
Obviously a topic that's on the screen. So we'll look at if we want to discuss it. Thank you very much. Next topic that's on here, Senator Kolb didn't join us today, but this involves a piece of legislation that actually came this year about unemployment insurance, changing it to the Unemployment Trust Fund and changing the name of unemployment insurance to reemployment insurance. Senator Cole's not here to inform us that. Director, anything? Wish comment? Okay. So if you got any questions, grab Senator Kolb and hit him up.
16 hours.
Yeah, we're obviously not going to spend 16 hours on it. Okay, the next topic on the bottom, page 15, there was from actually the Wyoming Business Council, as well as the Department of Workforce Services, involved housing and involved our workforces. There's and I would say an impending crisis. Frankly, it's a crisis already. In my part of the world we're dealing with, and we have a huge boom about to hit us. We have no housing. It's not available. We don't have the infrastructure to handle it. So it's an issue that we maybe need to look at. Any comments on that, Director? Your thoughts? Mr. Goldberg ducked out on us today. Go ahead, Director.
Thank you, Mr. Chairman, members of the committee. My name is Robin Cooley. I'm the Director of the Wyoming Department of Workforce Services. CEO Durrell contacted me last week about this issue. I think it underlies a lot of the topics that you've been discussing here today already around housing and workforce. And I would just add that more and more as we work together, as the Business Council and Workforce Services work together, along with our partners in education, whether it's UW, the community colleges, or K through 12, we're recognizing that all the overlap of these efforts, we are much more effective when we do work together and when we have that interaction and collaboration with all of us. And we're doing it much more now through the WIP as well. So this really speaks to that. It speaks to not only housing, but also developing that workforce in the various areas of our state. Everywhere I go, that's what I hear. I hear it, and it's very much a chicken and egg situation. But we need housing for our workforce if we're to develop our workforce. And we've got some great initiatives out there to develop our workforce, but we've got to be able to house them. And we've got a lot of great projects coming into Wyoming. It's pretty exciting a time for the state. But again, these are some pretty basic things we need to have in place in order to really make that beneficial to the state. I stand for any questions you might have.
Questions for the director? Say none. Thank you very much,
Thank you.
Director. Okay, we're moving along. You see, there's not as many pages as were when we started. That takes us on page 17. Ms. Decklever brought a topic to us about recruitment and retention of nurses and nurse educators. You know, we use the word crisis here a lot, and the fact is we have less and less nurse educators, and frankly, nurse staffing has become an issue, not just in state facilities, but in other facilities as well. Ms. Decklever.
Thank you, Mr. Chairman. Tony Deckler with the Wyoming Nurses Association. So this topic has come up several times. The only way that we can make nurses is by having nurse educators. Most of our nurse educators are our community colleges. All of our community colleges have an RN program. However, all of the programs also, when the students complete their first year of nursing school, they are allowed to sit for the LPN boards. The disadvantage of being an LPN is that basically the only place that you can work as an LPN are long-term care facilities. I started as a CNA in a long-term care facility, and I was the staff development director and a DON in a long-term care facility, and it is hard to recruit because, unfortunately, as complicated as long-term care is, it is seen as the lowest level of nursing, and it's our fault for this, but it's almost like, well, the nurses that can't make it anyplace else go to long-term care. It's not a desirable place for new nurses to work, and so many nursing students that have the opportunity to take the LPN boards don't, because they're working on completing their registered nurse and where they can work in an acute care hospital. Years ago, the Wyoming legislature developed a program called WIN, Wyoming Investment in Nursing. And it was two parts. One part was for student loans for nursing students, and with a payback provision that they had to work in the state to pay off their loan. And the other part was to pay schools the salary for their educators so that we could bring in more educators so we could teach more nurses. And a few years ago, the legislature took away the student loan part. And so the provision to assist the schools of nursing to pay for some of their faculty is still in place. However, most of the nurses, especially, or the nurses that work in the community colleges, unfortunately, are paid the least amount of money than any of the other professions. They have to be master's prepared, and they can, as a master's prepared nurse, can go into almost any other area of nursing and make a lot more money. So, and we understand that every part of a community college is important. And so to say that we need to pay the nurse educators more so that we can bring in more students, we know that that's tough. So if there was some sort of incentive or some sort of help for our nursing educators, that would be beneficial. Staffing is a big deal. We know that traveling nurses have been going all over the place, and a lot of the draw is for the money. We hope that that will settle down and that people will stay in place. But nursing's tough, and it's a tough environment. Nursing assistants in long-term care that's a tough environment. And even though they can go make a little bit more money at Walmart, to work in a long-term care facility 24/7, 365, it's difficult. And there is really nothing for our nursing assistants. If we want to recruit nursing assistants, there's really nothing for them. I can tell you because I stay connected to the long-term care education programs in our state. There are lots and lots of kids that want to go into healthcare. There are many of our high schools that have healthcare programs, and we do lots of things to encourage people to come into healthcare, and then they get into the system and they're like, whoa, this is not what I thought it was going to be, and they leave. And so if we could just figure out some ways to try and bring these people in that are interested and then keep them in, that would be helpful.
Questions, Representative Ward?
Thank you, Mr. Chairman. My own daughter would like to become a nurse, but she doesn't want to get vaccinated. So can you comment on vaccination and how that applies to this topic? Thank you.
Ms. Stecklever.
Mr. Chairman, Representative Ward, the schools do not require the vaccinations. The facilities that they do their clinical work are the acute care facilities and the long-term care facilities. And it is the facilities that currently require the vaccination. So we share the same, I was on a conference call not too long ago, and we shared the same hope that Director Johansson was talking about, that when the public emergency is lifted, maybe the vaccine mandate will also be lifted. But that's just one of the rules that we have to follow.
Okay. Thank you, Ms. Stecklever.
Thank
Appreciate
you.
it. Okay, page 18, middle of the page. And I see Senator Furphy's not with us either today. Oh, we did. I apologize. I skipped one on the bottom of page 17. Mr. Laycock's not here either, but this is a perpetual topic. You guys got to quit hiding in the back. Come on up.
Well, I mean, we already discussed it, but.
And this is a perpetual thing. We have a lot of new committee members who may need to refresh on this, but the aging population, the cost of treating the aging population, and there's a few of us on this committee that are a little older than some of you.
Really?
Yeah, I won't comment on that. But it's something that perhaps we need to refresh on. If you can just give us a brief overview of that, Mr. Laycock, welcome.
Sure. Well, thank you, Chairman Baldwin. I'm Tom Laycock with AARP Wyoming. So I noticed we have 6 new members of the Wyoming legislature here and a number of new members to this particular committee. So it just seems like a good time for a refresher on long-term care in terms of what the state does to keep our older adults living in their communities as long as they can, living in their homes as long as they can. So it's something that we do go over every few years. The Department of Health does a wonderful job offering specific programming to keep people living in their home as long as they can, which is a net savings over actually putting someone in a nursing home when that's a appropriate plan of care. So that's really what we wanted to bring forward. I also wanted to let you know that in about the next month or so, AARP is going to drop what's called the Across the States, the Long-Term Services and Support Study. It gives it's a compilation of about 30 different statistics. It lets Wyoming sort of see where it lives versus other states in various areas of care, as well as just things like demographic numbers, and even as granular as how many people are using the state's senior centers for things like home delivered meals and congregate meals. Interestingly enough, we rank 1 and 2 in the nation per capita for things like that. So we spend a lot as a state on long-term care, and we do that in a number of different ways. And it's a good idea to kind of kick around ideas for how we do it, why we do it, and ways that we can do it in ways that are the most cost effective.
Thank you. Questions from Mr. Laycock, committee? See, now we need to find a way to take care of the legislators that are getting older. No personal implication. Thank you very much, Mr. Laycock. Okay, now moving along on page 18, that brings us to a bill that was brought in the Senate. It was not considered, brought to us on this list by Senator Furphy, related to hearing impaired, deaf and hearing impaired, and the needs in the state for some more services, for better services to the deaf and the hearing impaired, specifically hearing aids, as there is no real support system right now. So we won't go in depth on that. If you got questions, ask Senator Furphy. Anybody on the committee wish to comment to that? Okay. Let's bring it up to the next topic about firefighters. And I would add to this one, and this is my personal prerogative since I participated in this, the EMT volunteers as well. And I agreed to lump this together. But what this amounts to is the majority of the firefighters in the state are volunteer. We have a number of combination systems. We have some municipalities that are completely paid firemen. We have some municipalities that are completely volunteer firemen. The difficulty we have now on the volunteer services is very well illustrated on my I'm chief of a volunteer fire department. I have 8 open slots. I've had 8 open slots for 2 years. I can't fill them. They either can't come in for training, which has increased. Likewise with EMT training, it's increased over the years, and people are less able to do those things. So we can't fill those slots. Consequently, when the call comes in, when I say when the pagers go off, that's kind of an antiquated system, but we still have pagers. When a pager goes off right now, if my pager goes off, I obviously can't respond. We may end up with 2 or 3 volunteer firefighters out on horrible, horrendous scenes, fires, car wrecks, whatever it be, we're putting the public at risk. And I think we need to address that. But if we could have got some fire service representatives back here, a handful of them, whoever, all three of you, come on up. Lanny's not coming up. You guys didn't pay him enough. He's a volunteer. He doesn't want to do it. Welcome, gentlemen. If you could introduce yourselves and present the issue to us.
Good morning, Mr. Chair. Jason Coyle, Laramie County Fire Authority, and the fire chief here right in outside of Cheyenne, and we cover 1,100 square miles, about 20,000 citizens that we protect as a volunteer combination fire department. This presentation to you is in regards to recruitment and retention, which isn't directly related to COVID. We do not require vaccination, so we'll get that question addressed right away. Over the last decade, we've seen a decline across our state with volunteer participation in volunteer fire service and volunteer EMS service. To combat that, we've struggled locally and across the state to entice folks to participate. And what we decided through the Chiefs Association, we partnered with the other associations across the state to provide a committee that would do a survey to look at what are the challenges that communities are facing. So as you heard from the Hospital Association and all the other associations so far, before those patients get to those healthcare facilities, we interact with them. We interact with them on a nightly and a daily basis before they are put into a system that can provide a service to them. And we do that through volunteers across our state. Through that committee, we did a survey where we had over 56% of the fire service participate. And of that, 86% of them stated that they had a significant need in recruitment and retention of their volunteers. And 93% of those organizations also openly admitted that a statewide program to look at recruitment and retention would be a benefit for their local communities. In addition to the challenges that Senator Baldwin, Mr. Chair, addressed as far as the time requirements, we also look at the fact that in many of our communities, we have an aging population of volunteers. Because we've had a hard time attracting the youth to stay in our communities, one, but also to provide an opportunity for them to participate because their work's taking them out of their community or not providing it. So for this request, we're seeking an interim topic to look at recruitment and retention of volunteers. And I agree, I think the EMS service is also a part of this, that we can look at to fund or at least look at a statewide marketing plan and other incentive programs that we can partner with local community and businesses to enhance the opportunities of our community members to serve in their communities. And I also have...
Go ahead, sir. Introduce yourself first.
Mr. Chairman, thank you. My name's Bob Glass, and I'm the fire chief of Wheatland. So I'm a pretty small rural fire chief, but I do cover a large geographic area because our outlying areas, which are covered by other tax districts, don't have the resources we do. So we go all the way to the top of Morton Pass from Wheatland, or we go all the way south of Chugwater potentially because they need our help. So we experience that and the same things that Chief Coy's discussing, and we're just hopeful that perhaps as a collective group we can come up with a way to entice people to become interested in the volunteer service. As other people have stated, it's hard to get people to pay people to come to work, and it's even harder to ask them to volunteer to come to work. Thank you.
In closing, Mr. Chair, we'll field any questions, obviously. The nature of this is to enhance public safety in our communities, and it's not feasible to fund career fire services for our communities. The millions of dollars that would cost is just not realistic. But the call volume has generated over the last decade and 2 decades. For example, in our organization in 2011, we ran 450 calls for service a year with about 30 volunteers. Today, we're asked to do 1,250 calls a year, and that's growing exponentially every year. But unfortunately, the number of volunteers that we're attracting is declining. And that's the story that you'll hear around the state. So this directly impacts public safety. It directly impacts the opportunity for us to provide a service to our local communities by enhancing the volunteer programs in those communities. I'll field any questions.
Thank you. Questions? Senator Hutchins.
Thank you, Mr. Chair. Hopefully a simple question. what made you volunteer? And maybe we can try to think about the kids today. They're in the basements playing the video games. I was a EMT and a volunteer firefighter in Alaska. Loved it. It was amazing. And I know what made me volunteer. So I'm just thinking, maybe you could think about what made you volunteer and see if we can maybe pass that down to the youth. Just a thought.
Chief or chief, either one.
Mr. Chair, through you, I started as an explorer at the age 13, and I'm 53 years old now. I'm one of those aging populations, getting closer. And we have a unique program at Laramie County Fire Authority where we provide 18 beds for college students to come live in our stations, to go to community college. We utilize Casper Community College and a distance learning program. We pay for their tuition reimbursement. We pay for their room and board as long as they achieve C averages. I asked that same question, what drew you to us? And a lot of it is the excitement, the passion. They want to serve their community is the standard answer. But then I correlate that to our business folks that live in our community that work. And really what they like is the family, the camaraderie, the ability to be a part of their community and serve in their community. Unfortunately, the burdens of being a part of a volunteer organization have grown so immensely because of state and federal regulations for training, hazardous materials. If you go back to when I started a long time ago in the volunteer fire service, all we did was respond to fires, grass fires. We responded in a pickup truck with a little bit of training and a little bit of skills. We didn't have SCBAs, we didn't have cancer concerns, we didn't have all these additional concerns. And so because of a lot of those additional concerns, it scares a lot of our folks away. And so figuring out how to attach the family, the camaraderie, all those pieces that they love about the volunteer fire service, but also balance those requirements as far as training and as one of the other topics, the things that we see as volunteers, having programs established to do that. But first, we got to get them in the door. We got to be able to attract them. We got to be able to get them in the door, and then we got to have a system to get them engaged and connected so that they feel part of the families.
Further questions, committee?
Chairman,
Go ahead, Senator Dockstader.
I remember those years when it was just structure fires. Our guys are rolling with every traffic accident now. Is that standard across the state?
It is, unfortunately, the vastness of the services that we apply. The fire service, especially the volunteer fire service, has become the catch-all for all incident types. And as our world has changed over the last 100 years, but specifically the last 50 years, between hazardous materials, search and rescues, vehicle accidents, now electric vehicle accidents, all of these things are being captured by that volunteer in your community. And thus we have to have the training and the skill sets. So part of it is the call volume continues to grow, which is fun, but also a burden on us.
Thanks. Do you put up the Christmas lights too?
Yeah. They're LED now, they're not as bad.
And I would add to that, I lose more, I don't know about you guys, but I lose more of my volunteers after the first one or two calls that go where it's a horrendous accident with body mutilation, et cetera. I have guys that say, no, I can't do this anymore. I lose a lot of volunteers that way. Anyway, that being said, thank you, gentlemen.
Thank you.
Okay, I just saw Miss Davis walk back in the door, which means I'm going to bring her up next. And Mr. Boley can wait a minute. And all these things, if you skip committee to page 21, you'll see, I think all the rest of the topics are suggested by Miss Jen Davis here from the governor's office. Actually, they're all things that we've kind of touched on a little bit already. If she can just touch on them one at a time for us. Number one, restructure of WWAMI incentives. Although this one is not for forensic pathologists, this one's for primary care. So maybe we need a bigger WWAMI program. And number two was EMS infrastructure, which is another thing that we're working on. And just go ahead and take those two and then we'll go from there.
Good morning, committee. Thank you, Chairman Baldwin. I'm Jen Davis with the Governor's Office. I wanted to put forward a few topics that have come up out of the Governor's Health Task Force over the last couple of years. So the first one here is looking at our WWAMI program and looking at a possible restructure with that program. It's been very successful in Wyoming for recruiting and retaining our physicians from Wyoming, but is there an opportunity that we can look at in the WWAMI program to further incentivize primary care? As we know, that's one of our major needs in the state. And so if we could consider taking a peek at that to see what we might be able to further do there. And then I'll jump to the second one, which is the EMS infrastructure, looking at funding and staffing. As you all know, you all passed a bill already this session for the EMS districts. And as was testified during that bill as it moved through both chambers, is that we know it's an option for the toolbox, but we know it's not going to completely solve the issue that we have around our frail infrastructure for EMS in the state. So we have been working on this in the Governor's Health Task Force, have a specific EMS subcommittee that has been looking at some possible alternatives of how we might start to think about the system. You all invested some ARPA money into the EMS system as well. So we've made great progress in this space over the last year, but we're still not fully there. So I'm just asking that we still consider how we think about this as a service in Wyoming, and then particularly how we'd like to fund it. And then also how that ties into our other first responders such as fire. As we've had a lot of discussion with EMS, there's also been a lot of discussion of how that plays into our volunteer fire force as well, because many of them are also EMTs and paramedics. So I think just digging into this system a little bit more to figure out where we have opportunities for efficiency, and then figuring out how we fund it.
Okay. Any questions on those items before we go to the next items committee? Okay, let's jump on to the next one. Is mental health, substance abuse infrastructure. 3 branches of government, and why don't you combine that with mental health service, crisis services?
All right, thank you, Chairman. Sorry, excuse me. So the first one is the mental health substance abuse infrastructure, looking at the 3-branch approach. As you all know, Governor Gordon has prioritized mental health in the state. In doing that work, we have committed with the other 2 branches, with the legislative branch as well as the judicial branch, of how do we look at this collectively. Mental health issues significantly cross all 3 branches. So this is a topic to just really keep on the radar of the committee as we start and continue to do work in the mental health reform that's been started, and looking at other things. How do we keep this committee involved in that conversation? And then looking at, as more conversations unfold, is there any potential legislation that needs to come out of that? So it's really kind of an opportunity to collectively keep this on the radar with the 3 branches, and determine any needs that we might have that might require legislative action. Within that, one of our priorities looking at that, as you all know, we have the community mental health center reform. And then there has been a lot of discussion this session, as you all know, around crisis services. Andy Somerville spoke of that earlier as a possible interim topic. One of our areas, particularly around crisis services, is youth. We don't have services for youth who are in crisis in Wyoming, and very often they're sitting in inappropriate settings such as a jail or an emergency room, because we just don't have anywhere for them to be served in our state, and very often rely on our neighboring states that are very often full as well. So unfortunately, we have youth who are lingering in the system and not really getting the care that they need. So looking at opportunities that we have to start thinking about how we address those crisis services, particularly in our youth.
Questions?
Chairman?
Mr. Davis. Go ahead, Senator Dockstader.
You're talking about a very serious subject. We got to get something done. We got a horrible rating across this nation. But is there a way, when you talk about the 3 branches of government, substance abuse, mental health problems, is there actually a way that we might consolidate and do a better job with less government organized in down one path, if I'm saying this right, rather than doing it several different offices or several different areas?
Ms. Davis.
Chairman Baldwin, Senator Dockstader, yes, I love that. I think that would be beautiful. And I think that's really our intent, is It's so complicated. It's so multifactorial about who all is working in that space. We have public, we have private. How do we really streamline that and find efficiencies in our system? And then we also have the division between our three branches of government. You know, we have laws and statute that govern how we do things, which may need to change based on how a person moved through the court system or through another system. So I do think that that's really important, is we have to, I think, really lay out a vision and a trajectory for the state and figuring out where we want to go. And that, I think, has really been the hope with the three-branch approach to this, is that we can get really intentional in how we look at this.
Further questions for Ms. Davis? Thank you very much, Ms. Davis. I think you've reached the end of your topics.
Thank you.
Okay. Yeah, we got some more. That was just the end of Ms. Davis's. But we're close to the end. Mr. Boley, would you like to come talk to us about prior authorizations? Or Josh? Was this volunteer or forced volunteerism, Josh? Okay. Tell us about prior authorization for treatment and how we can address that.
Sure. Mr. Chairman, again, Josh Hannes with the Wyoming Hospital Association. So very briefly, and this is maybe an oversimplification for those who aren't aware, that prior authorization is a practice where insurance companies essentially require a provider to get permission to deliver a service or a procedure to a patient before they'll agree to pay for it. One of the problems being, however, is that even if it's prior authorized, they may still deny the claim after the service is provided. It's an incredibly burdensome practice on providers. It delays patient care. And we think it's something that we should look at and see if there's something we can do at a state level and policy to improve that situation for providers and for patients. Happy to answer questions. That's a very quick overview.
Questions, committee? Go ahead, Representative.
Thank you, Mr. Chairman. You know, I pay an employee, that's her whole job. It's all she does all day is pre-auth, right? So, but do you feel like the state, through some type of legislation, could tell these insurance companies, we're going to make changes to your system?
Go ahead, Joe.
Mr. Chairman, Representative Clauston, I think on a limited basis, our state Department of Insurance, for example, doesn't regulate all insurance, health insurance provided in the state. I also think it's worth pointing out this may not be able to impact the state Medicaid program. They may operate under some federal rules that we can't change at a state policy level. But I think to a certain degree, we could impact this and look at, if it's not complete elimination of the practice in some of our insurance, what could we do to mitigate some of that administrative burden you've identified?
Okay. Further questions? Go ahead, Representative Young.
Thank you, Mr. Chairman. So, Mr. Hannes, I got denied from a prior authorization just this last week. And so I'm curious on what, in my experience as a patient, there was no transparency on why I was denied, and that the only way that I could find out was literally ask the provider. Is that kind of transparency something that you think the Hospital Association or others would be interested in providing to patients to understand why they're denied by their own insurance company that they're paying money for?
Go ahead, Josh.
Mr. Chairman, Representative Yin. Absolutely. So the transparency doesn't exist necessarily on the provider side either. Every insurance company has a different process, requires different paperwork to submit their authorization requests. The transparency on denials on the provider side is similarly opaque for us. So the transparency would be helpful, yes, sir.
Very good. Further questions? Thank you for coming up and addressing us. We're down to two topics, committee. On page 24, topic came from Tamara, and I'm assuming Tamara didn't make it today. No, she's from Evanston. This issue is something you've heard a lot about this session, and that's about suicide prevention. Although she states something interesting in here, which to me makes sense, and that's addressing the suicide prevention from the upstream side. You know, we talked a lot during session, and we talked about during the interim about addressing when somebody expresses suicide ideation, about when the suicide is imminent, et cetera. This proposes addressing it more from an upstream side, about the mental health before we get to that point. And I think that goes back into our mental health system all the way, what we've been talking about all day today, and we've talked about all session, frankly. But this talks, and I would like us to address treating suicide prevention from the upstream side. before we ever get there. You know, it's easy when people are drowning in the river and we catch them when they're drowning. Sometimes we save them, sometimes we don't. But if we can go up the river and actually address that before we ever get to that point where they're drowning, maybe we can make a bigger difference. And I think that's the gist of this proposal, is addressing that suicide prevention before we get there. So with that in mind, that brings us to one final topic, which I believe is in the care of Chairman Swaninger. Go ahead, sir.
Thank you, Mr. Chairman. This came from our Children's Law Center over the Hill. It was a bill that we had, I think it was actually in judiciary. Actually, it came to labor health, and I think about it. We did some interim studies on this topic the last couple of years, but it really deals with children in difficult situations and lack of options. And so in many cases, we put them in centers, confinement centers, basically, because it does overlap somewhat with our boys' school and our girls' school. I think Machine's here, actually. I'll just invite her up, and she can go over the significant issues. But it mostly comes down to just lack of services, like many other areas of Wyoming. And when it comes to our kids, it's an issue we have to figure out how to solve somehow. But if I could turn over, Ms. Sheen, go ahead.
Thank you, Chairman Swanitzer, Chairman Baldwin. I'm Donna Sheen with the Wyoming Children's Law Center and the Wyoming Youth Justice Coalition. And yes, our issue does dovetail nicely with a number of things. I'm reminded of an example on the suicide issue where that you may have heard a podcast about a parent who was telling the story of her child who was on the eve of being sent to the Wyoming Girls School and committed suicide because of her fear. That mental health issue, that imminent suicide, our court system doesn't necessarily have a way of really monitoring the mental health of children who are within its system. And so I think this committee, I would urge you to take a really close look at what those procedures look like and whether a court system is really the best place a lot of times for us to try and be adjudicating the need for mental health, but also what resources and what direction we're giving our courts in terms of how to address those mental health issues that children have. And I would argue that our multidisciplinary teams that are charged with doing that don't really have enough direction. But I would also say that the way we regulate and license facilities in Wyoming, which is something I believe that Ms. Davis is referring to, and what facilities we have for what purposes for children are also problematic. We have Department of Health that certainly oversees some mental health facilities and standards, but then we also have Department of Services that we assign child care facility licensing. And we don't really have a standard for what, whether one meets a mental health care need, whether we're evaluating the children's mental health care needs when we're sending them to a youth residential facility that's licensed, for example, under Department of Health. So I would really urge you to take a close look at those systems because I think there needs to be better regulation. There was also large controversy that came up about private entities that are able to run in Wyoming and be youth caring facilities who essentially have no standards. They're able to call themselves residential treatment programs, but have no standards really that are treatment oriented, that hold them to an evidence-based treatment standard. So.
All right, any questions?
Thank you.
Anyone else on that topic in the room? Chairman Baldwin, if it's okay, can I just check the rest of the room and see if anybody who didn't submit an interim topic but is here and really has one burning on their mind? Ms. Rodet, come on up. And then agencies, if you have anything else that we didn't talk about that you have, you see on the horizon, let us know. Go ahead, Heather.
Good morning, Mr. Chairman and members of the committee. All I'm offering up is to tell you that we're offering a resource that we're going to send around to you because I highly suspect we're going to talk about health insurance this interim. So this piece of paper just has a little bit of a glossary for your reference over the interim. Thank you.
And Chairman Baldwin, I think I have 6 new people to process, 8 new committee members on LHSS. So maybe at our first meeting, we will have some kind of overview, training, education stuff this interim as well, I think, because I certainly know I need it. Director, welcome.
May I suggest that somebody put together a glossary? We did that 2 years ago, a glossary of all the terms that we use in this committee. I don't know if the LSO can help us out with that. a glossary of all the terms. Tell us what CMS, tell us what all those things are. All the terms that we use in this committee that all the new members may say, what the heck is that? So that's a big deal.
I believe Chairman Wilson had it a couple of years
She
ago.
did.
It's probably
I
still
bet
in the
she's got
files
it.
somewhere.
Knowing her, I bet she's still got it on her computer, so.
Yes. With that, Director Johansson.
Thank you, Mr. Chairman. Chairman Baldwin, I'm sure those acronyms have grown by at least 10 to 20% since that document was made. Along those same lines, members of the committee, while we didn't submit this or the items that I'll mention as a specific interim topic, I certainly wanted to offer either individually or for the committee, whether committee time is used or not, the Department of Health materials and sort of education resources since we have so many new members. We prepared that years ago for the Labor Health Committee and for the Appropriations Committee, really Department 101 type stuff, Medicaid, as well as our other divisions, our facilities, our services in the director's office with licensing and survey, et cetera. To the extent that anybody would like to meet on that or to receive those materials, or if the committee would like time with those educational materials, happy to provide them. In addition, as several of you know, many years ago, a lot of our annual reports that the legislature required were replaced by a department performance management system that we refer to as HealthStat. Every year since 2011, we provide a report on all of the department programs, kind of in the same format, the same value chain, outputs, outcomes, efficiencies, et cetera. And we're finalizing that HealthStat, the 2022 HealthStat report this week. And we'll make sure to get hard copies and digital copies to the committee. Again, a good reference material for all of the department programs, which are voluminous, 60 or 70 programs contained within that resource. So certainly would offer that to the committee. And then, Mr. Chairman, I did want to mention, because we're so excited and thrilled with what the state has invested in over the past several years, we have 3 brand new state-of-the-art facilities in the Department of Health, at the State Hospital, at the Wyoming Life Resource Center in Lander, and at the Veterans Home, a new nursing facility on the campus in Buffalo. We are, as many healthcare providers, we are struggling to staff those fully. But since we have opened those buildings over the past year or two, would certainly offer individually for all of you, if anybody would like to see those facilities, take a tour, more than happy to schedule those, or if it worked out where we're close by for a committee meeting, I'm more than happy to schedule a tour. They really are, members of the committee, state-of-the-art facilities for very, very vulnerable safety net populations that I couldn't be more pleased that we are occupying those and licensed for the services. Wonderful, wonderful buildings and spaces for these residents that we serve. With that, Mr. Chairman, again, not specific interim topics, but wanted to mention those items. Thank you.
Thank you. Director Cooley? And any other agency directors, come on down if you do. We got about a couple minutes left. Oh, Senator Bouchard, do you have a question?
I had a question for the.
Come on back, Director.
And maybe a request that.
Sure, throw it out.
Let me embellish it for the committee. You know, looking back at my 6 years on this committee, if I had to get one thing from the department, would be a list of acronyms and how they map in to all of the various systems. So, I mean, could you work on that for us? I mean, because there's new members of this committee, and that would be very helpful for them as we navigate forward.
Mr. Chairman, Senator Bouchard, happy to do that.
I think so. Director Cooley, welcome.
Thank you, Mr.
Couple minutes
Chairman,
left,
members
yep.
of the committee. Robin Cooley, Director of Workforce Services. I didn't want to get ahead of either Senator Kolb or Representative Wiley on the workers' comp or unemployment insurance benefits issues, but I just wanted to offer to you that we have offered to both of them to work with them on these systems. They're very complex systems and very integrated, and to the extent that you have any questions, please let me know. We've got experts in the agency. We're happy to answer any questions as you're looking at how you might want to work on these during the interim, whether it's fraud, Representative Trujillo, or whatever the issue is. We stand ready to help out with those.
Okay.
Thank you
very much. No questions? All right, and Mr. Bulley, do you have something else? Welcome back.
Thank you, Mr. Chairman, committee members. Eric Bullis, Hospital Association. Just quickly, 2 years ago, we also did about a 2-hour session, I think, with the new committee and helped educate on a lot of the terms and terminology and how hospitals and nursing homes operate. We'd be willing to do that again. We have our presentation ready. And then Chairman Zwana, sir, there was maybe you've already worked it in, but I know that the Wyoming Board of Nursing Home Administrators had a quick fix for some statutory problems that were created by a quick fix a year ago. So I'm just wondering if we could sneak that in so we could take care of getting nursing home administrators their licenses.
Instead of a third quick fix, we might actually spend some time on it, make sure we get it right this time.
Get it right this time, yep.
I think we can appreciate that. Sure. All right, with that committee, again, if you just submit, your top 3 to 5 to 6, maybe rank them if you feel appropriate. If you want to group some together to your respective chairman, we'll get together probably Wednesday and finalize some topics with Donna and Anna. And for those of you who don't know, Anna is our interim attorney, Anna Johnson. And we'll get some of the management council written up by Thursday. And then we're not having a management council meeting until I think the 3rd week of March. But after that, we do have set some interim dates. I sent those out to the House. We have 3 committee meetings, not scheduled anywhere specific yet. So if there's somewhere you want to go in Wyoming, let your chairman know. I hear Wamsutter's nice.
Yeah.
Yeah. We'll probably go to Casper for at least one meeting, I'm guessing. So
Yeah.
any questions before we adjourn from the committee or talk to your respective chairman, and we'll try to answer any offline. Thank you all for being here. If anything else comes up next day or two, let us know. And we're going to have a very long day in the House. I hope the Senate is a little more methodical. You can come watch all day. We'll be here at 10